Good morning. I'm Alexis Del Cid. Clearly, I'm not Dr. Steve Stites. Dr. Stites is our Chief Medical Officer at the University of Kansas Health System and the Executive Vice Chancellor at the University of Kansas Medical Center. As you know, we're a working hospital. He's running a little late this morning, so I'm going to kick off the program for our monthly edition of Open Mics and the Show Me the Science program. Today, we're talking about burns. Over the last 2 decades, survival rates and functional outcomes after severe burns have improved, not because of a single breakthrough, rather because of advances across critical care, surgery, wound biology, and rehabilitation science. Ezra Crutchfield was able to use those advancements, and they benefited him greatly. The 17-year-old was enjoying a bonfire with friends, as so many teenagers do, when a gas can exploded, catching him on fire. Here's Angie Racono with his story.
So I caught on fire right about over here. And then once I caught on fire, I ran directly down over here to the water and jumped in.
Ezra Crutchfield was 17 years old when a small gathering of friends around a bonfire took a terrible turn. He noticed a gas can was sitting too close to the fire.
It caught on fire, and so I tried to kick it to get it away from people. And then when I kicked it, it caused it to explode. And then it got all over me. I think I was on fire for a total of 11 seconds, and I had to run to the water over there to put myself out.
A friend quickly drove Ezra the short distance to a nearby community hospital.
And I can remember up to getting out of his truck once we got to the emergency room and walking in and walking up to the doors and them opening. And then I don't remember anything after that until I woke up in Kansas City.
That's because the University of Kansas Health System is home to the Burnett Burn Center, the only adult and pediatric burn center in the greater Kansas City area. And Ezra was burned on 46% of his body.
So when you're up near 50% at the 46% that Ezra was, we have to deal with a lot of other issues.
Like organ failure, dehydration, and even shock. Large burns can be deadly. Ezra was young and had no other complicating medical conditions. He also benefited from newer technologies like Nexobrid.
This is an enzymatic debrider. This is going to remove the dead tissue.
A big challenge with large burns is determining what skin is salvageable and what needs a graft. Those decisions can waste precious time.
To be able to go in with this product early on, put it on, and then 4 hours later start wiping it away to see what kind of tissue is left underneath and know, okay, I'm going to need to put a skin graft, or no, there's lots of healthy skin here, so we're not going to have to do a graft. It really shortens the time till we can act, which is great.
A general rule of thumb is 1 day in the hospital for every % of the body burned. Remember, Ezra was burned on nearly half his body, but his hospital stay wasn't 46 days, it was 34 days. Here he is with his team when it was finally time to go home.
Recovering takes a lot out of you, and you're always on drugs, so you can never think straight. And it just messes with you, trying to figure out what you're supposed to do and everything when you can't think straight. So that makes you a wreck. And then it was just painful. Long road to recovery, but I got there.
We recently met Ezra back near the lake where his senior year took that awful turn. He showed us his scars, a lasting reminder of what he's been through and what he overcame with the help of his medical team.
They're all great. They saved my life. I'm so happy that they're there. Probably the best burn unit around.
Ezra here with us this morning. Ezra, thank you for taking the time to join us, along with the director of the Burn Center, Dr. Julia Slater, and we have Ezra's therapist, Ann Schwartz. Ezra, the first thing I want to ask you is, how are you feeling today physically? How do your arms feel?
I'm feeling almost 100%.
What's holding you back from saying it's 100?
Just slight bits of range of motion that I'm still working on to get back to full.
Full Ezra. What's the last thing you remember before that horrible accident?
I don't know, just enjoying my time, just talking to people, and
right,
just being a kid.
Just, I mean, I could see, you just remind me of any teenager. I mean, I can't tell you how many times my son goes to bonfires with his friends and they're just hanging out around the fire. Thank God there was a body of water nearby. How long did it take you to get into the water?
Right around 10 seconds.
10 seconds. So your instincts, you knew, get in that water. So we do know that Dr. Rapid cooling can limit burn depth if it's done quickly and safely. So when you look back, Ezra, do you remember doctors or nurses explaining to you how valuable and critical that decision was?
A little bit. Not really, though. I was on a lot of drugs during that time. I remember after I got out of the hospital being explained to it and then really understanding it.
And in the story that we just aired before this program, we talked about how much of your body had been burned. It was more than 45% or around 45%. Dr. Slater, when more than 30% of the body is burned, the injury can trigger a whole systemic inflammatory response. The capillaries become leaky, patients will lose fluid rapidly, organs are placed under extreme stress. And then there's research that shows that early precise fluid resuscitation and temperature control within the first 24 hours are critical predictors of survival. Can you talk a little bit more about modern burn protocols like goal-directed fluid resuscitation and vertical beds help blunt that inflammatory cascade of events?
Sure. So we use a lot of different techniques to help with our patients with large burns that are experiencing that inflammatory change. One of the first things that we see in these patients is that you go into a shock state when you have a burn that's that big. And so you don't have enough volume in your vessels to actually get blood to your organs, as well as you're losing fluid through the injuries to your skin. And so replacing those fluids in the first 48 hours is really critical to making sure that we don't have a patient start going into organ failure or pass away because of the effects of the shock. And so we utilize those fluids very rapidly for that. We have lots of other advances, things like a new vertical bed that our unit just started using that help us to get patients that are too sick to really get themselves out of bed, still to be able to get upright. And that really helps to get better lung volumes, which decreases inflammation in the body, decreases risks of pneumonia, things like that. So we've got lots of different techniques that we're utilizing upstairs at the Burnett Burn Center.
Ezra, how long were you in the vertical bed?
Ezra actually wasn't in the vertical bed. We just recently got that. We used some other different positioning things with Ezra for his.
Oh, got it. Okay. Yep. And Anne, when it comes to severe burns, we know they don't just damage the skin, they can affect muscles, joints, nerves, connective tissue. So when you first met Ezra, what were the biggest functional concerns that you were concerned with and watching for?
So, like you were saying, we were just looking at what areas of Ezra's bodies was burned and then how we want to position that in a way that can promote healing. And so since most of his burns were on his torso, back, and upper extremities, we made sure to position him in a position where his arms were resting kind of in an out position. If you're healing with your arms by your side, and always resting with your arms by your side, then you'll heal that way. So we wanted to make sure that he was positioning well, and the positioning can also help reduce edema or swelling, because a lot of edema can help prevent movement and function. So a lot of times at the beginning it's positioning and range of motion, and then whatever function that they're able and have at that time as they're so early on in their injury.
When you're conducting physical therapy sessions with a burn patient like Ezra and they still have these open wounds, what does the physical therapy look like?
So a lot of the times it looks like range of motion. So active range of motion is better than passive range of motion, but if the patient can't participate in actively moving, then we help them passively move what is affected. A lot of the times therapy, both occupational therapy and physical therapy, can see patients during dressing changes. So while the nurses are doing their dressing changes, we go in and we can stretch and move the extremities affected to see how it's moving without bandages on. So we can do therapy really early on, and it's actually best to start therapy within 24 hours of the patient being admitted to the hospital.
Ezra, I can't imagine healing from all those burns and undergoing therapy and having to move. What was your pain level?
It was rough, that was for sure. Probably a 9 or 10 while I was in the hospital. Wow. About the most painful thing I think anybody could go through. who, but I'm lucky to have such a good staff at KU Med that helped me get through it, and we're nice, even though I wasn't nice most of the time.
I'm sure you were very sweet. You're a sweet guy. That's so gracious of you to then put the spotlight on your doctors and your nurses and your therapists. Your hands were burned everywhere except the palms. What's your range of motion now?
About 95% for my hands.
Okay.
I just have one thumb that's still working on to get full range of motion back, and
Okay.
that's about it.
Does it feel super tight when you try to clench your
Yep.
fist?
Just when
And-
I try and move it down towards my palm,
Okay.
it's kind of locked in almost a straight position with able to do a slight bend.
Oh, interesting. So, and from a reconstructive and rehabilitation standpoint, how significant is the outcome that you're seeing, though, in Ezra right now?
I mean, Ezra, him being able to use his hands to how he is really amazing. He was very motivated to work on his hands. A lot of the times, if patients want to be able to feed themselves or want to be able to play video games or whatever it is they want to get back to using, you just have to find the motivation to get the patient to want to move their hands. So Ezra was someone who wanted to return to how he was before.
Sure.
And so that motivation really is helpful in recovery.
When we were talking with Ezra just now about the range of motion and it feeling tight, that's the scar tissue, which is different than normal skin. So how do you continue with your physical therapy to make sure that that skin doesn't tighten up?
So scarring and knowing that scarring is going to occur is one of the driving factors to our rehab plan. Our normal intact skin can stretch up to 50% of its original length. Immature scars can stretch up to like 15%, and the mature scars can only stretch up to about 4% of their length. And so that occurs about like 12 months out or so. So that doesn't mean that you're permanently stuck. It just means like while the scars are healing and getting more mature, we really want to make sure that that motion is there. So for Ezra, we're like, okay, we know scars are going to happen. How can we make sure that as they're occurring, we still maintain that motion?
Dr. Slater, let's talk about Nexobrid, that topical gel that you were demonstrating in the story that Angie did. It received FDA approval in 2022. It expanded to pediatric patients in 2024. It's a fascinating demonstration you do for us in this video. And this is so interesting. It's derived from the stems of pineapples. First of all, how did they figure out that the stems of pineapples could do this? And how is this able to differ from the dead tissue and the healthy tissue when you put it on?
Yeah, so I don't know exactly how they quite made the link, but I think a lot of people have probably noticed that if you're eating pineapple or a lot of pineapple, you feel almost a tingling around your lips.
Yes.
That's the bromine. And they kind of noticed that there was some type of reaction there and were able to study it further to see that it has the ability to actually target certain proteins, which they won't necessarily tell us which ones, but in dead tissue that's not healthy. And so because it's targeting these specific proteins, it doesn't do damage to healthy tissue, but it connects and binds directly to those proteins in the dead tissue so that then that dead tissue can be wiped away at the end of the treatment.
And Ezra, were you awake during this part or are you out during this part?
I think I was asleep during this part.
Yeah. So
It looks like it'd be...
Yeah, for Ezra, we were able to actually partner it with some of his other surgeries. It is very painful while it happens. And so typically if we're doing it on an extremity, then we'll have our pain team that we partner with do nerve blocks so that patients don't feel it. Because we wanted to treat Ezra's back, there's not a way to do a block. And so we chose to put it on his back as we got into the operating room when he was under general anesthesia and not feeling it, and then wipe it away before we woke him up after a surgery where we were working on his arms.
What was the worst part burned, Ezra?
Probably my arms.
Your arms. Okay. And when I have a question for Dr. Slater, as a non-medical person, when we look at you using the Nexobrid, is that the same as debriding when we hear about debriding?
You know, it's an adjunct. It's an enzymatic debridement, so it does take away tissue. Certainly when you have very thick, full thickness burns, it's not going to take away all the tissue that's dead, like doing a surgical debridement where we're going to use a knife to take it away. But it's something that we can use, that when we think there may be healthy dermal tissue or that second layer of skin that's left, we can use it to try to preserve as much of that as possible and see if we can get some healing. For Ezra, we were very lucky that we were using it on the back, where the dermis, or the second layer of skin, is the thickest in your body. And so there's a lot more chances that you're gonna have healthy skin underneath. And so we partnered two of our newer technologies, both the Nexibrid and then using spray skin, which are just a suspension that we make from his own skin that we are able to process in the operating room, called ReCell. And we sprayed that on top. So rather than taking large grafts and putting it over his back, we were able to just take a very small area, make it into a spray, and spray it over his back. And there was enough healthy skin left that with the spray, it was able to heal, and we didn't have to graft him, which, to save him not having those donor sites, is huge.
Oh my gosh, that's so interesting. And really, we're so blessed to be in a health system that has the state-of-the-art treatments and technology. We have a graph that actually shows the success of Nexobrid compared to what is considered the standard of care. So this is revolutionary. How has this treatment option revolutionized the way you treat your burn patients?
Yeah, you know, we have a lot of patients where we get burns and you just can't tell looking at them, is there going to be enough skin for them to heal quickly enough? Or are you going to need to do surgery? And in the past, all we could do was sit and watch them and kind of keep an eye on it. And now to be able to get the Nexibrid on early and figure that out right away, do they need surgery? Can we just get them into dressings and they're going to heal? It saves time as far as in the hospital, so that patients aren't just waiting around. It also helps to get dead tissue off of patients quicker, and that decreases inflammation. And when you can decrease inflammation, we hope that that will lead to decreasing in future scarring.
Ezra, how many days were you in the hospital? Because you shared some pictures with us of you with your care team.
Just a little bit over a month. I think 36 days, 34 days in the hospital, and then another 7 days in in-house rehab after that.
I've never seen a patient looking so happy undergoing everything you went through. What was it about your care team that gave you such comfort and joy during a really hard time?
They were just all so nice and vibrant and pleasant to be around, and kept my moods up, and it helped me keep a smile and a brave face on while I was there.
Who's that guy?
That is Nurse Johnny.
Nurse Johnny? Were you real close with Nurse Johnny?
Yep.
I love that.
I was close with everybody there. They did a lot to save my life, and I really appreciate all of them.
What's it feel like to be back, and now you're in a television studio with two of the people who are a huge part of your team?
Definitely not what I expected to be happening right now.
No one expects that. We're so glad, though, to have you and have you looking so happy and well. We're here to answer our viewer questions as well. So if you have a question or a comment that you'd like us to read out loud on the program, just be sure to send it to us on YouTube, Facebook, or you can email the Medical News Network. Let's check in now with Doc Hawk. Dr. Dana Hawkinson, what do you have going on today?
Yeah, hey. Well, we're back after a good holiday winter break. So I think things are a little bit better as far as respiratory viruses.
Oh, yeah.
We'll see here in just a minute, yeah.
Flu cases skyrocketed a few weeks ago. I know I was blowing up your phone because I had the super flu and then pneumonia. And I think I barely remember texting you, quite frankly. I was so sick until I looked at my phone after and I thought, oh boy, poor Dr. Hawkinson's going to be tired of me.
We're glad you're better. We're glad you're better.
Thank you. So there were so many people who were sick. So some of those numbers have leveled off. Respiratory viruses, though, are still very much in the mix. Can you tell us about that?
Yeah, so certainly we know that there continues to be a high level of flu activity, although it is improved from where it was a few weeks ago. We know that it is still circulating quite a bit in the community. This is information for Kansas, but this follows closely what we are seeing nationally as well. So if you can see there, there is a peak early on. That's where we were. We have come down. That other red line, that higher peak, is later in the season. So we can expect also a second peak to come, but so far we have passed that first week. And again, this is a graph showing influenza-like activity. So patients that are ill with common symptoms of cough and cold or influenza, fevers, chills, runny nose, cough, are presenting to emergency department, primary care visit, or urgent care. That is what this graph is showing. And again, you can see there was a peak there. It has improved, decreased, although now we are starting to see both locally and nationally maybe a slight increase as well. So flu numbers are quite high. We know that overall for the past flu season, or this current one, there's already been 11,000 deaths, and unfortunately as well, 52 pediatric deaths.
So that was a statewide graph that we just showed. How is it looking here, hyperlocal in Kansas City, when we look at our health system admission numbers?
Yeah, again, in the community, it's still really the same. We have showed this graph before. This is updated. This information is from last week, as we are able to collate that and put it up there. So as you can see, a few weeks ago, there were very high amounts of flu influenza admissions. Those are the blue bars. It has come down significantly. The green and the orange bars are RSV and COVID as well. So there still remains low level but current activity of RSV and COVID. But unfortunately, influenza activity still remains high. And we know that probably, like you said, I knew you had it. We probably know people who have had it recently as well.
A common question that we're getting from a lot of people is it too late for you to get the flu shot? Even after you've had the flu, can you get the flu again?
Yeah, well, to answer that question, so certainly we know that after you had the flu, if you haven't been vaccinated, it is important to get vaccinated, because what we do typically see is that maybe in the first part of the season there is one predominant strain that is circulating, but later on a new strain will come through and circulate. So we do see that quite often. So to answer your first question, if you have had influenza during this season and you haven't been vaccinated, you should still get vaccinated, because we know that other strains can come through. The vaccination will give you protection and will prime that immune system. And I would also like to say that overall, we know that there has been a significant decrease in overall uptake of influenza vaccine, not only for young, healthy people, but even for older people, or even people with chronic comorbid conditions that set them up for severe flu complications, but also in pediatrics as well. Across the board, there has been low influenza uptake, and I think a lot of that is because, number one, people just don't understand that they need to get it. You know, we know that we have been fighting a large misinformation campaign about vaccines in general, about science and medicine, about people saying the flu vaccine doesn't work. That's absolutely not true. The flu vaccine does provide a boost to your immunity, to prime your immunity, if you are going to get exposed or infected with one of those influenza strains. Just imagine what it would be like if you didn't get vaccinated with influenza. So even if you get influenza and you've been vaccinated and the strain isn't a good match, it will still provide protection. So there is still time to get vaccinated against influenza if you haven't been this season. It will still take, 7 to 10 days to really build some immunity, but it is still recommended to get it even now. I would say that for even COVID as well. If you haven't had a COVID vaccine in the last 6 months or a year, you should get that as well. So these are all things to, number one, not reduce your chance of getting infected, although that we know that in the first 3 to 4 weeks after COVID vaccine, it can have that beneficial effect, but it is to reduce the complications and overall severity of those infections when you do get it. And they do work to do that and improve your overall outcomes, reduce your chance of going to the hospital or going to the ICU. So it is vitally important to continue to give that message. It is still really recommended by medical societies for everybody to get influenza vaccine who is 6 months and older. Would continue to endorse that, and there still is time to get it if you haven't already.
Dr. Hawkinson, thank you so much for your time. We know you have patients to see. We really appreciate you.
Thanks
for answering your texts, too. Let's get to those community questions. We have a great comment from one of our viewers, Diane Schwartz. She writes, great story, what a great team. We're fortunate to have a team like this in Kansas City. Yes, we are. Thank you to all of our doctors, nurses, and therapists. Maggie has a question about the cream that we talked about, Dr. Slater. She wants to know, is the cream used everywhere and does it help with scarring?
So you can use it over the body pretty much anywhere. You just have to be careful that it's not gonna, if you're using it near a face, you're not gonna get it into eyes or anything like that. So it does limit, when it went through the FDA approval, how much of the body you can use it on at a time. So you can only use it on about 15% of the body, with a possible extra 5% in a second application.
Okay.
So we couldn't just put it on a whole body. Like, we couldn't have used it on all of Ezra's burns. We had to be specific with where we used it. And the thought, again, we know so little about who's going to form bad scars. Things that we do know are that if wounds are left open for a long time, typically over 3 weeks, they are at a much higher risk of forming scars. And so using the Nexabrid to help shorten the time to healing can definitely help decrease the risks of forming worse scars.
Jill has a question for Ezra. She wants to know if you still do PT for mobility, what that looks like, and where you might still have pain specifically.
I still do PT, but just by myself, like at my house. I was just doing hand exercises and doing regular stretches just overall.
Like what kinds of hand exercises do you do?
Just like stress balls and stuff like that.
Okay.
And just using my hands for everything and taking extra effort to fully extend them and close them just throughout the day.
Marie wants to know, when were you able to go back to school after all of this? How did it affect your school?
So I missed the first semester of my senior year, or while I was there, and I managed to go back for the second semester and graduate on time with the rest of my class.
Oh, there you are. Oh, that's so good. Oh, man.
I was smart enough to get most of my credits required for high school early on, so I was I was lucky enough to be able to finish that.
And I bet you're a charmer, which helps, right? I bet your teachers love you. Is that your mom there, the football mom?
Yes, ma'am.
How has that affected your sports? Have you been able to play sports again?
I did manage to play golf my senior year. It was at the very end of the year, so I was able to be recovered enough to do that.
As we wrap up this discussion, I want to get some final thoughts. This has been such a tough thing that you've gone through, but such a joy to see Ezra doing so well. Ezra, do you have anything that you really want our viewers to know that you wish they knew about people who are recovering from burns or your experience here?
It just takes time. You got to be patient and trust the medical professionals to do what they're good at.
Mm-hmm. And that's what you've done. What's on your bucket list? What are your plans for this year?
I'm going to barber school and I want to graduate from that.
Oh,
And
nice.
get my license.
Have you always been into hair?
For a while.
Uh-huh. Who do you practice on when you're doing that? Because my son was trying and he practiced on all his friends. We saw a lot of bad haircuts in our neighborhood.
I practice on a lot of my friends and my siblings.
Oh, nice. And well, congratulations with barber school. Can't wait to see what you do in the future. And what would you like our viewers to know?
Just how great that medical staff at KU is.
Love that.
Ezra's story is just one that is just really heartwarming. It's always so fun. When he was having more frequent appointments in the burn wound clinic, he would come up and visit. And so I think it's stories like this that make it really rewarding to still be working with patients with burns, just seeing the recovery and the impact they can make.
Dr. Slater, what would you like our viewers to take away from this conversation?
Yeah, I think it's a couple of things. I think Anne alluded to the fact that Ezra was so motivated, and I can't say enough about how important that is for a patient's recovery, for them and their family to get on board and really be motivated to get back. And that's not an easy thing to do when you're suffering with such a severe injury. And then the other thing is just how grateful I am to work in a health system, as well as the Burnett Burn Center, where we value the importance of new technologies, the research that goes into them, and being able to bring that to help our patients every day at the bedside.
Dr. Slater, you're at the top of your field. We are so blessed to have you in this community and at the health system. Thank you all for taking the time to join our program this morning. And Ezra, best of luck to you as you continue on living your life, living your best life. As we know, February is American Heart Month, so coming up tomorrow on All Things Heart, the season premiere of it, you'll learn the symptoms that led to the diagnosis of a rare heart disease that often goes undetected. This is a story of survival and a father who refused to give up. That's tomorrow morning at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.